Welcome to our day 3 of our 7-day Pharmacology NCLEX training. So if you are in nursing school or you're preparing for the NCLEX, this 7-day training is for you. And today we will be covering cardiovascular medication. Just a quick review. We've been doing 2 days already, our live training. On our first day, we covered a little bit about some general concepts about critical thinking, okay? And I think that first day, day 1, and day 2 was extremely beneficial to you. So if any one of you here watching this live training on YouTube today, or maybe you're watching the recording and you haven't seen day 1 and day 2, it is very important that you go back to the beginning of the training so you don't get lost. So welcome everyone. Cardiovascular medication, day 3. A quick change from the original schedule that we had, that we thought of doing for our 7-day training. Originally, we decided for cardiovascular medications to only be covered on day 3, but we have to add another day of cardiovascular medications because when I was creating the presentation, I noticed that it was too much information for only one day. So tomorrow, day 4, we will continue with cardiovascular medications. Why? Because cardiovascular medications, respiratory medications, emergency medications are the most common questions that you will see about pharmacology on the NCLEX. So I want to dedicate a lot of time to these topics so you can really get ready for your NCLEX and pass your NCLEX on your first attempt or your second attempt or third attempt, whatever it is, whatever you are in your journey. So a frequent question that I get when I talk to my students is there a list of medications that I can study for the NCLEX? In other words, Professor, can you tell me 50, 100, 200 questions, 200 medications that I definitely need to know in order to pass pharmacology the NCLEX day? The answer to that question is no. I don't have it. Nobody has it. Why? The NCLEX, the NCSBN, which is the governing body that creates the NCLEX, does not provide the information of what medications will appear on your NCLEX day. However, with that said, I want to cover today some categories of medications that frequently appear on the NCLEX. Based on my own experience, my wife's experience, who also took the NCLEX several years ago, and the experience from hundreds of nurses in our academy that have taken the NCLEX and passed the NCLEX. So I want to share with you the most important categories. And remember, we will cover some today and we will cover some tomorrow. So I hope that you find this day 3 very beneficial. I hope that so far you found our 7-day training extremely beneficial for your NCLEX preparation. So let's begin with cardiovascular medications, the category of anticoagulants. So anticoagulants are extremely important for the NCLEX because there is a lot of safety concern when it comes to the use of anticoagulant medications. A lot of questions on the NCLEX deals with safety relating to the use of anticoagulant. But first, by definition, what is an anticoagulant? What is the intended purpose or intended effect of an anticoagulant? It is used to prevent the extension and formation of clots. And how is this completed? How is the body able to react to this medication? Well, basically by inhibiting factors in the clotting cascade and decreasing the blood coagulability. So it is important to understand the effect of how an anticoagulant medication works, so we know that these patients are in extreme risk of bleeding. So a lot of teaching with the use of anticoagulants deals with bleeding. When is an anticoagulant administered? It is administered when there is evidence of or likelihood of clot formation. It is also used in myocardial infarction, unstable angina, atrial fibrillation, deep vein thrombosis, pulmonary embolism, and also the presence of mechanical heart valves. Now, anytime I put something in red, okay, or burgundy, it's important that you take note of that, because that is an NCLEX tip for you. Anticoagulants are contraindicated in patients with active bleeding, and it makes sense. If the use of anticoagulants can cause bleeding, imagine using it when there is bleeding. So it's contraindicated in the use in a patient that is with active bleeding. Bleeding disorders, dyscrasias, ulcers, liver or kidney disease, and hemorrhagic brain injuries. Now, what are some known anticoagulants that appear very often on the NCLEX, and what is the lab value that you need to monitor? First, we have heparin sodium, and remember to monitor PTT. We have enoxaparin, which is a low molecular weight heparin. Remember that for this medication, you have to monitor the anti-XA assay. And warfarin sodium, or coumadin, you have to monitor PT-INR. Sometimes I see students getting confused on whether you monitor PTT or PT-INR for the heparin or warfarin or coumadin. And I have a tip that I always share with my students that maybe can help you, okay? If you look at the medication heparin, okay, let's count how many letters heparin has. 1, 2, 3, 4, 5, 6, 7. Okay? So heparin has 7 letters. Now, use your fingers, okay? Use your fingers. You have 10 fingers, right? Heparin uses 7 fingers. You're left with 3. PTT. So that is a good resource that you can use. It may seem goofy, but it is good to remember. Heparin has 7 letters. You got 10 fingers. You have 3 fingers left. Remember PTT. Now, if we look at warfarin or coumadin, okay? If we count the letters on coumadin, there are 8 letters. So out of the 10 fingers, you have 8 letters. You have 2 left, PT. So PT-INR. So remember that. You will never forget about what to monitor with heparin and warfarin or coumadin. So it is an excellent technique that you can use to recall, to remember. Anytime you find one of these tools to remember, use it. Write it down, because it will save you from making a huge mistake when it comes to some of these medications. All right. Now, in this training, in this live training, we will be talking a little bit about content. Okay? Remember that I told you at the beginning, I don't go into a lot of in-depth about content. I prefer to use the time here live with you to discuss critical thinking and practice questions. However, for pharmacology, there is no way that you teach pharmacology without teaching content. So I have to teach some content for today's training and tomorrow's training. but also we will always have the opportunity to practice questions. So let's begin with the first question of today's training, day 3, cardiovascular medication. This is a very interesting question that I want you to analyze with me. It says, the client diagnosed with a pulmonary embolism is receiving IV heparin. So now we have a medical diagnosis, which is pulmonary emboli. It's telling you that the patient is receiving heparin, but the healthcare provider also prescribes warfarin once a day. So now we have 2 medications involved in the treatment for the patient that was diagnosed with a pulmonary emboli or pulmonary embolism. The question states, which statement best explains the scientific rationale for prescribing these 2 anticoagulants? So the question is, I need to find the best answer that explains the reason. That's what scientific rationale means, to explain the reason of why the doctor is prescribing heparin and warfarin. So this is a very important question. Number 1, answer number 1 says, Coumadin interferes with the production of prothrombin. 2, it takes 3 to 5 days to achieve a therapeutic level of Coumadin. 3, heparin is more effective when administered with warfarin. And answer number 4, Coumadin potentiates the therapeutic action of heparin. So if you comment on the comment section what is your answer, if you're watching this video later on, comment on the comment section your answer and why you think that is your answer. So we have several answers that are correct, but we're looking for the best explanation of why the doctor is prescribing warfarin and heparin together. And we see that if we study pharmacology, that heparin has a very short half-life, and Coumadin or warfarin takes several days to act and produce a therapeutic effect. So if we look at answer number 1, it says that Coumadin interferes with the production of prothrombin, but this does not explain the reason why we are mixing Coumadin and warfarin. Answer number 1 only talks about Coumadin, and it says that interferes with the production of prothrombin, but it's not giving the explanation of why they're mixed together. So answer number 1 we can eliminate. Answer number 3 says heparin is more effective when administered with warfarin. You have to understand that heparin works one way and Coumadin works another way. They work in different steps in the bleeding cascade. So this does not specify why these 2 medications are being prescribed together. So we can eliminate answer number 3. Answer number 4, Coumadin potentiates the therapeutic action of heparin. This is also false. One medication works in one part of the cascade, the other medication works on the other part of the cascade. And it does not say the correct reason of why the doctor is prescribing heparin and warfarin. The correct answer is answer number 4. And the reason behind this is because it takes 3 to 5 days to achieve a therapeutic level of Coumadin. It works slower. So at the beginning of the treatment, the patient will be taking heparin and Coumadin together until the Coumadin starts making the therapeutic effect. Once it reaches the therapeutic effect, then the heparin is discontinued and the patient will only continue with warfarin orally. So this question is a content-based question, but you can always use that process of elimination to select the correct answer. Another category that I want to share with you this evening is the thrombolytic category, thrombolytic medications. Thrombolytic medications activate plasminogen. Plasminogen generates plasmin. And what is plasmin? Plasmin is the enzyme that dissolves clots. So if you look at the category, the word thrombolytic, you can see the purpose of this medication, which is to destroy or to dissolve thrombi or clots. So this category group will work in dissolving blood clots. Thrombolytic medications are used in the early course of myocardial infarction, and this is an NCLEX question. It is used in the early course of a myocardial infarction within 4 to 6 hours of the onset of the infarct. If it tells you in the stem of the question, the patient had a chest pain, he's been having chest pain and had a heart attack 20 hours ago, then the use of thrombolytic is not an appropriate medication to administer. Why? It needs to be administered within 4 to 6 hours from the onset of the infarct. Okay? Thrombolytic use: arterial thrombosis, deep vein thrombosis, occluded shunts or catheters, and pulmonary emboli. What are medications that are known as thrombolytic medication? We got ateplase and tenecteplase. Okay? But this information here about within 4 to 6 hours of the onset of the infarct is extremely important, and you could see it definitely on your NCLEX. So you have to know this. Remember, if at any point in time you get confused, go back to the video, listen to it again, and take detailed notes. Thrombolytic medications contraindications. In other words, what are scenarios where it will not be appropriate to use a thrombolytic medication like ateplase? 1. Active internal bleeding. 2. History of hemorrhagic stroke. 3. Intracranial problems, including trauma, head trauma, intracranial or intraspinal surgery within 2 months, thoracic, pelvic, or abdominal surgery in the previous 10 days, history of hepatic or renal disease, uncontrolled hypertension, recent or prolonged cardiopulmonary resuscitation, and known allergy to the medications or the preservative for the medication. So these are 9 contraindications to the use of thrombolytic medications. What is this that I'm showing you right here? This is a select all that apply. Most of the select all that applies come from concepts like this one. So you need to write this down, because a question could be, the nurse is providing in-service training to a group of new nurses on contraindications for the use of thrombolytic medication. Which of the following should be included in the teaching? Select all that apply. And then they give you 3 or 4 or 5 correct answer and 1 incorrect answer, or all of them are correct or only 1 incorrect. Remember that rule changed for the NCLEX. Let's review another question, and we are going to go back to remember what we taught yesterday. So if you weren't here yesterday when I talked about the intended effect the side effect or the adverse effect, you may be a little lost on this upcoming question. So if you haven't seen that and you're watching this day 3, pause it and go back to day 2, because it will help you select the correct answer. The question states, the nurse is administering Atteplase to a client diagnosed with a massive, keyword here, massive pulmonary embolism. Which data indicates the medication is effective? You see, this question is a little bit tricky, because if you remember yesterday, we talked about that usually when they talk about a medication being effective, they provide clinical manifestations of the patient's problem within the stem of the question. But in this scenario, they're not. They're giving you a medical diagnosis and they're telling you which data indicates the medication is effective. So what an interesting scenario this is. This is an above the passing level style question. Because in order to answer the question, you have to remember, first, what are the clinical manifestations of a pulmonary embolism? In other words, what will you see in the assessment on the patient with a pulmonary emboli? 2, you have to know what Atteplase is and what is the intended effect or mechanism of action of Atteplase. We just talked about Atteplase 2 or 3 minutes ago. So we're looking at a scenario where there are no clinical manifestations, but they're giving us a medical diagnosis. So what are some symptoms that a patient can experience when the patient has a massive pulmonary emboli, massive pulmonary embolism? We're going to see restlessness. We're going to see apprehension, sudden onset, keyword, a sudden onset of dyspnea, difficulty breathing, chest pain, cough, hemoptysis, hypoxemia, crackles. These are the clinical manifestations that we can see in a patient with a pulmonary embolism. Now, which of these 4 answers indicates that the medication of Atteplase for a pulmonary embolism was effective? In other words, we're looking for symptoms that improve, but there were no symptoms given on the stem of the question. So that is a harder level question. We look at answer number 1. It says the client's partial thromboplastin time, or PTT levels, is within therapeutic range. You have to use knowledge here to know that the PTT test is used to monitor heparin, like we just discussed a few minutes ago. But it is not used when administering a thrombolytic Atteplase. So answer number 1, by knowledge, we can eliminate. But remember, we're looking at clinical manifestations from the symptoms of the patient. Okay, so that is keyword here. Look at answer number 2. The client is able to ambulate to the bathroom. And you may think, well, if the patient is able to ambulate, is better. But look at the keyword on the stem of the question. It states, the nurse is administering. This is a verb that indicates that the process of medication administration is happening now. We are giving now Atteplase to this patient. A patient that we are administering Atteplase, a patient who has a pulmonary embolism, shouldn't be walking to the bathroom. So this is an unsafe response. Okay? And it would not indicate that the medication is effective either. So answer number 2 is eliminated. Answer number 3, the client denies chest pain on inspiration. So remember that one of the symptoms that a patient experiences in a pulmonary embolism, it is that sudden onset of chest pain, that sudden onset of dyspnea, cough. So if now we see a patient that the pain is not there, that means there is improvement on the patient's condition. So answer number 3, excellent, possible answer. Let's look at answer number 4. The client's X-ray is normal. Okay? What is the problem with answer number 4? First, it is a radiologic diagnostic exam, but a normal X-ray is not going to indicate that the symptoms of the patient with a pulmonary embolism got better. And usually, a patient with a PE, the chest X-ray is completely normal. So answer number 4 is eliminated. The correct answer is number 3. Now, also take a look at this concept. Answer number 1 deals with lab values, lab levels. Answer number 4, diagnostic test. Answer number 3 deals with patient's symptoms. And remember from yesterday's training, when we're looking for an effective sign, an effective condition, where we see that whatever medication that we give improve the patient's condition, we want to look up the patient's symptoms. What were the patient's symptoms before? What are the patient's symptoms now? So the correct answer here is answer number 3. Another important category of medication in cardiovascular medications that appear on the NCLEX are the positive inotropic and cardiotonic medications. How does this medication work? The positive inotropic and cardiotonic medications. These medications stimulate the myocardial contractility, the contraction of the heart muscle, stimulates the contraction of the heart muscle and produces a positive inotropic effect. So you have to learn about contractility. You have to learn about inotropic effect. These medications are used in short-term management of advanced heart failure. The increase in myocardial contractility improves cardiac, peripheral, and kidney function by increasing cardiac output. But it also decreases the preload of the heart, improving the blood flow to the periphery and kidneys. But it also helps in decreasing edema and increasing fluid excretion. Now, what are some examples of this category of medication? We have dobutamine and dopamine. Both of these medications are used in the short-term management of heart failure. Okay? It increases the myocardial contractility of the heart muscle and improves cardiac performance, but also dilates renal blood vessels and increases renal blood flow and urinary output. Now, all this information is excellent to know this, but a lot of questions on the NCLEX deals with nursing interventions when you are administering these medications. So what are some important nursing interventions in a patient that we are administering a positive inotropic or cardiotonic medication? First, monitoring vital signs. Look at the numbers, okay? When we're giving these medications, the vital signs are taken more often. Every 5 minutes to 15 minutes. When we're giving a positive inotropic or cardiotonic medication, we are not waiting 30 minutes or 1 hour to monitor vital signs, especially the blood pressure. We have to do it earlier, every 5 minutes. And in some patients that are extremely hypotensive, we are looking at taking the blood pressure even continuously, like every minute. We have to do a 12-lead EKG and monitor the patient's heart continuously. So the patient needs to be on a continuous heart monitor or cardiac monitor. Monitor the urinary output, okay, every hour during the administration, and report to the doctor any decrease in the urinary output, because this can indicate the patient is decompensated. Report any change in the quality of peripheral pulses, or if the extremities become cold or mottled. You have to confirm doctor's order, look at the rate of infusion, and see if it has to be decreased or discontinued depending on how the patient is responding. So if we look at these nursing interventions, one of the most important that you will see pretty frequent on the NCLEX is talking about extravasation, infiltration of the blood vessel. Remember that if there's infiltration of this medication, it can cause necrosis of this tissue. So this is important to monitor. Any signs of burning, sensation, edema to that IV access site, we need to monitor that and think that it could possibly be extravasation. Also, we have to monitor the potassium levels and liver enzymes. So let's look at a scenario where a patient is in cardiogenic shock and we're about to administer dopamine. It says, the nurse is preparing to administer dopamine to a client diagnosed with a cardiogenic shock. So what is the medication provided? Dopamine. We just talked about this medication. The patient is in shock, cardiogenic shock. Which intervention should the nurse implement? So now we're looking at a select all that apply. Remember that on, I believe it's day 5 of this 7-day pharmacology training, all the questions that we will be practicing that day will be select all that apply. I know that many of you continuously ask, Professor, let's practice more select all that apply. So I want to dedicate all the questions that we do on day 5 of our 7-day training to be select all that apply. So if you're weak on select all that applies, you want to practice select all that apply questions, remember day 5 is the day we will be practicing that style of question. So frequently when nurses analyze this scenario, they select all the answers as correct answers. And although a select all that apply could be all of the answers correct, this scenario is not the scenario, because not all of the answers are correct. Remember that the patient is in cardiogenic shock and we are administering dopamine. Look at answer number 2, and I told you to pay attention to the numbers. The patient in cardiogenic shock is extremely unstable. We have to monitor that blood pressure, if not every 5 minutes, earlier. I know that in the interventions for the administration of dopamine, it says that every 5 minutes up to every 15 minutes. But we got a special condition now. The patient is on cardiogenic shock, was diagnosed with cardiogenic shock. So we have to monitor sooner, every 5 minutes, minimum, if not early. So answer number 2, we can eliminate. Answer number 1, ensure the client is on a cardiac monitor. We talked about that. Answer number 3, evaluate intake and output, urinary output every hour. We talked about that. Instruct the client to report burning at the IV site. We talked about that. We talked about extravasation and what are the signs of extravasation and complications with the IV site. And we talked about assessing peripheral pulses because this is important for the cardiac output, to assess cardiac output and heart contractility. So we've practiced some questions today. We've talked about some important medications, and I want to practice some more scenarios with you guys. I want to provide some more information about other cardiovascular medication. But remember, if you have not subscribed to our channel, do so. Click the subscribe button, activate the bell, and also find the video and like the video that you are watching right now. I always ask this. This helps me a lot. We have about 620 live attendees, live nursing students or preparing for the NCLEX. Please hit that like button right now. I want to see all the likes in this video. It helps me grow my channel. It helps this channel grow. And I know you want that. So all of you, without the exception, hit that like button and share this video with other nurses who are struggling. Okay? Perfect. Remember, we have a Telegram group. Our advisor is going to be providing the link to our Telegram group. If you want to join it to be up to date, go ahead and do that. All right? But let's continue with cardiovascular medications, and let's talk about direct acting vasodilators. Vasodilators are extremely important. They appear very often on the NCLEX as well. So I want to provide some information about direct acting vasodilators. Thank you to all of you who has been supporting our channel, donating for our channel, liking our videos, subscribing to our channel. I appreciate it very much. So direct acting vasodilators, they help in relaxing smooth muscles of the blood vessels, mainly in the arteries, causing vasodilation. So that's why they're called direct acting vasodilator. With vasodilation, the blood pressure drops and also sodium and water is retained, resulting in peripheral edema. Diuretics may be given to decrease the edema. So we're talking about a side effect that we could see with the use of direct acting vasodilators. So remember, we have intended effect, the reason why we're giving a medication, but there are some undesired side effects, okay, and adverse effects. So with direct acting vasodilator, promote increase in blood flow to the brain and kidneys. These medications are used in the client with moderate to severe hypertension and for acute hypertensive emergencies. So this category of medications are included in emergency scenarios. Remember, one of our training days is going to be about emergency drugs. Okay? These are some of the medications that are given in an emergency scenario. Hydralazine, nitroprusside, and nitroglycerin. Nitroglycerin is given often as a drip, okay? And nitroglycerin is also given for chest pain. Remember, some of these medications are given to attack different problems. What are some important nursing interventions when we administer medications such as hydralazine, nitroglycerin, direct-acting vasodilators. Okay, we give these medications, we have to monitor the blood pressure. If the medication you're giving affects the blood pressure, you have to monitor the blood pressure. If the medication you're giving affects the heart rate, you have to monitor the heart rate. If the medication you're giving affects the respiratory rate, you have to monitor the respiratory rate. So the area or mechanism of action of how that medication works, you have to monitor that. So monitor blood pressure, and if the blood pressure is less than 90/60, you cannot give a vasodilator because it's going to create a severe hypotension. So you could see a question on the NCLEX where you have to hold the medication and question the doctor. For IV administration, you have to have the patient on a cardiac monitor. So if you're going to give this medication IV, the patient needs to be on continuous cardiac monitor. The patient needs to be at bed rest, not walking to the bathroom. We have to give the patient a urinal or a bedpan. When we're giving this type of medication, cannot let the patient work because remember, the patient could have orthostatic hypotension. And we have to avoid the use of nitrates, let's say nitroglycerin, with patients that have erectile dysfunction and they're taking medications such as Viagra. Remember that Viagra is a phosphodiesterase, and if we mix a phosphodiesterase with nitrates, with medications that lower blood pressure, the patient can suffer from severe hypotension. Vasodilators, in red, important. Vasodilators causes orthostatic hypotension. Instruct the client about safety measures when taking this medication. If you're giving this medication at the hospital, not walking. If the patient is taking, let's say, medication at home, then we got to tell, not walking. We got to teach the patient to raise from the bed slowly, to stand from the bed slowly in order to avoid orthostatic hypotension or preventing the patient from falling. Okay? Very good. Vasopressors. Vasopressors such as metaraminol and norepinephrine rapidly restores BP in situations such as anaphylaxis by producing vasoconstriction and stimulating the heart. Here are two known medications that are given as vasopressors: norepinephrine, metaraminol. Monitor the client's vital signs, intake and output, mental status, peripheral pulses, and skin color. If we're giving a vasopressor the same way as the previous category that we just covered, we have to monitor the patient on telemetry, on cardiac monitoring. Let's do another critical thinking scenario. This is a very, very interesting scenario. Let's see how that critical thinking is doing today. This is a priority question, and you can see priority questions like this. The stem of the question will state, which medication should the nurse administer first? And they give you 4 patients with 4 different scenarios, 4 different conditions, and 4 different medications. And you have to identify what medication you administer first. There is a strategy known as the SAR method strategy. I taught that in our first 7-day training. There are also videos on our academy, on the membership side of the academy, that you can learn how to use the SAR method strategy. And basically, what you're doing in scenarios like this, you're trying to identify, okay? You're trying to identify if the patient's condition is an acute or chronic condition. Many times, nurses only pay attention to the medication, and this is a mistake. Although the question is about medication, and there are 4 different medications, you have to also look at the patient's condition. So in this scenario, we're giving clopidogrel for a patient with arterial occlusive disease. And hear me out. This question is not difficult, but I want you to learn the strategy, the concept. What is the condition on answer number 1? The condition is a chronic condition. Look at answer number 2, digoxin for a patient diagnosed with CHF, chronic. Look at answer number 3, iron for a patient diagnosed with iron deficiency anemia, same. Look at answer number 4, amiodarone for a client in acute. This means acute. In ventricular bigeminy on the telemetry monitor. Now, if we look at answer number 3 and 4, because answer number 1 and 2 we can easily eliminate. We're dealing with chronic conditions. There are no exacerbations. So we're left with 3 and 4. And yes, I know that answer number 3 has iron deficiency anemia, but look at answer number 4. Is in ventricular bigeminy. What does this mean? Bigeminy. We're talking in answer number 4, we're talking a scenario where the patient is in a dysrhythmia. This patient is in danger of going into cardiac arrest. So if we don't act rapidly with this antidysrhythmic drug, amiodarone, the patient can go into cardiac arrest. The patient can go into VTAC, ventricular tachycardia, and then cardiac arrest. But even though, let's say you're looking at the answers and you don't recall the medications, you don't remember what clopidogrel or Plavix is, you don't remember what digoxin is, you don't remember what amiodarone is, but you're looking at also the medical diagnosis, the condition, and you're looking at the clinical manifestations of the patient. Answer number 4, the patient has a premature ventricular contraction that it is happening bigeminy, means every other beat. Bigeminy. Trigeminy means on the 3rd beat. Coupling PVC means in pairs. And run of VTAC means 3 or more consecutive PVCs. If you're a little lost with EKG, find that EKG class in the membership. It will help you a lot. So, although you could be having some struggles with the medication in this scenario, by understanding the clinical manifestation and diagnosis described in each answer, you can select the answer. Because answer number 4, a patient in ventricular bigeminy is the most unstable patient. Therefore, if the patient is the most unstable, I need to administer that medication first. So this is how you use your critical thinking. Don't make that mistake. Oh, I don't know pharmacology. I don't know this medication. I'm just going to pick whatever and go to the next question. No, read it. Analyze it. Sometimes, even when you're weak in content in pharmacology, sometimes, not always, you can still select the correct answer. So, day 5, tomorrow, okay? Day 5, no, tomorrow is day 4. I apologize. So day 4, we will continue with cardiovascular medications. Okay, so tomorrow at 5 p.m. we will give another class, another live on cardiovascular medication, so you can continue to improve in these medications. Okay, remember, we have a membership. I posted the link in the comment section, in the description. If you want to join our membership, here it is. I've talked plenty about it. There are different categories that you can join. You can watch a lot of prioritization, a lot of strategies. It's very cost effective for most of you. Thank you very much for being here. God bless you all. See you tomorrow at the same time, 5 p.m. Eastern Standard Time, on our day 4 of our 7-day pharmacology training. God bless you all. Bye-bye.